This is Dr. Corey Maas on Looking Your Best. Today I wanted to answer a question from one of our video bloggers, and I think it's a really good question, and that's about the use of Kybella in general outside of the neck area, which would be an off-label use of this product. And the package insert of the FDA recommendation say specifically that Kybella is not recommended outside the chin area, mostly because there's no studies about it and not much knowledge. That doesn't mean doctors can't do it. That's what off-label use is. But it also, and people should be aware of this, there isn't a lot of data yet published about of the use outside of the neck area. Now that doesn't mean the fat is fat, so wherever you inject fat it's going to work. But what we know about Kybella is it can be an irritant to nerves and possibly other tissues, and it really works only, on fat. So we want to make sure that wherever we're using it, doesn't matter if it's, on the, bottom of your arm or on the little bra fat area here, or in areas of the abdomen or other regions where there might be irregularities after liposuction, for example, where we're using it quite extensively. It doesn't matter where the fat is, it almost always works. So really, fat is fat, and the body's reaction to the deoxycholate molecule is going to be the same. Now, specifically, we had a question that I think was a very good one. Miss Player sent me a question asking, can she use it in the area where the foot or ankle joins the lower leg, which often is referred to as Cankles. And this is an area that's been difficult to treat historically. Liposuction has been tried with some success, but it is an area that's very difficult because the skin is very tight in this area, and of course the legs are dependent, so there's often very much swelling and bruising associated with it. And so it does sound like an attractive area. The only thing that is cautionary in this, and there's a number of them, is that there are a number of sensory and motor nerves that travel through this area. And so before we get into the injection, someone would certainly have to be thoroughly understanding the lower leg anatomy, and especially the ankle lower leg junction anatomy, because that junction is really where all the nerves that help to supply the toes and the flexion of the foot, or at least near that area where the flexion of the foot and the extension of the foot occur, the nerves and muscles that affect them, we do not want those to be injured. So it wouldn't necessarily be our first choice in treating that area. Now with that said, as time passes, as experts get involved in more of the use of deoxycholate or Kybella, I think we'll see an expansion of the indications. And that may include areas like the ankle, which I know the company that makes it is looking at a number of different indications for them. I would say the main off-label, and we're doing a study here at the Maas Clinic right now looking at off-label indications. And those for us are primarily areas that are irregular fat after liposuction. Especially this happens on thinner people or people with washboard stomachs that had a little lipo and they've got little lumps or bumps. And we're using it in combination with Selfina to really get rid of cellulite. There's an inflammatory process in skin tightening, and so in my opinion, the way that cellulite ultimately will be treated will be with Selfina, which is just a simple way of undermining, and with deoxycholate in combination. And my associate, the plastic surgeon associate that I work with on these and other procedures, are excited about the technology and combining these technology to get super outcomes. So relative to the question about Miss Player, it's a great question. I would say right now, foot and ankle expert, the only one I would allow to inject until we have a very clear picture of what the limitations of Kybella or deoxycholate are. But there are certainly off-label indications that are being used, that will be published. You're starting to see publications and certainly a number of presentation papers presented at our scientific meetings, which are very exciting. If you have any other questions about Kybella, deoxycholate, or any methods of removing unwanted fat or body shaping, please don't hesitate to call or write drmaas.com. Happy to have this dialogue, and I really appreciate it. We'll be talking to you very soon.